Welcome to Horizon Health Network's video on baby care. In the postpartum video, you learned that immediately following birth, baby is placed in uninterrupted skin-to-skin. This is a time for bonding, enjoying your baby, and breastfeeding for the first time. Skin-to-skin contact should continue uninterrupted for as long as you wish. You may want to hold off on visitors during this very special time. Skin-to-skin contact is an amazing start for you and your baby. It helps your baby adjust to life in the outside world, regulate heart rate, blood pressure, blood sugar, breathing, and body temperature, develop protection against harmful bacteria, feel safe and warm, calm down when fussy and cry less, control pain during blood tests and needles, and get off to a good start with feeding. Skin-to-skin helps you bond with your baby, feel more confident caring for your baby, recover from giving birth and regulate your hormones, recognize when your baby is hungry, and helps with breastfeeding and milk supply. During the first few hours after birth, your baby will have a physical assessment completed. This includes examining baby head to toe, measuring length, head circumference, and weight. This information will be written on a card and attached to the crib. Listening to heart, lung, and bowel sounds, making note of any marks on the skin, such as birthmarks, and assessing any swelling, bruising, or molding of baby's head. You may notice changes to your baby's skin in the newborn phase. The following are common and don't require any treatment. Vernix or peeling, a waxy substance that protects baby's skin while in utero. You may notice your baby still has some vernix on their skin or just in their creases. Babies born before their due date are more likely to have some vernix. Those born after their due date may have dry, peeling skin. Baby acne can occur on baby's face in the first few weeks of life. It will disappear on its own. Newborn rash is a splotchy red rash which can have white bumps. This can come and go on different parts of the body. Milia are tiny white bumps on your baby's face. Mongolian spots are flat birthmarks that range from brown to gray or blue-black in color. They can resemble bruises and are often found on the lower back and bottom. They will fade on their own over the first few years of life. They are common in babies with darker skin color. There are 4 routine procedures that are recommended for your newborn. Vitamin K injection, given during the first day of life, is given to prevent bleeding problems of newborns in the first few weeks. Hepatitis B vaccine injection, given during the first day of life, to reduce the risk of getting hepatitis B. This is part of the New Brunswick immunization program and the first of a series of immunizations. If you have hepatitis B, further immunization is also recommended. Maritime metabolic newborn screening blood test by heel prick is done on newborns between 24 to 48 hours of age. Early screening is done for a number of serious, rare conditions that are treatable. You do not need a family history for your baby to be at risk. Hearing tests should be done during the hospital stay. This is to detect possible hearing problems. This is a New Brunswick Department of Health screening program. If your baby requires further follow-up, this does not mean he or she is hearing impaired. All blood work and testing should be completed while your baby is breastfeeding and or skin-to-skin with you to reduce pain. While in hospital, you and your healthy newborn will stay together and be cared for as a team. Your nurse will help you learn to respond to your baby's needs. Making a decision about how to feed your baby can involve many factors. Learn as much as you can about feeding your baby so you can make an informed decision that is the best for you and your family. Education and support are available from your healthcare team. See Horizon Health Network's video for information on breastfeeding. If you have made an informed decision to use infant formula or are supplementing for a medical or personal reason, you will be taught one-on-one how to prepare, safely store formula, and feed your baby. It is important to make note of your baby's first bowel movement. While in hospital, continuing to make note of how often your baby feeds and how many wet and dirty diapers they have are important tools in assessing how they are feeding. You will be provided with a feeding and elimination diary. This chart shows what to expect with regard to your baby's elimination in the first few weeks of life. For example, Day 2, babies should have at least 2 wet diapers and at least 1 to 2 sticky dark greenish-black stools or meconium. Continue to make note of the first few days at home until breastfeeding is well established. Safe sleep. Sudden infant death syndrome, SIDS, also known as crib death, refers to the sudden and unexpected death of an apparently healthy baby under 1 year of age. Such deaths usually occur when the baby is sleeping and remain unexplained even after a full investigation. Nobody knows how to prevent SIDS, but the latest research shows that there are things you can do to make your baby safer. Maintain a smoke-free environment in your home and car. Breastfeeding is known to be protective. Always place baby on their back to sleep, never their side or stomach. There should be nothing in the crib other than the tight-fitted crib sheet over the firm mattress and the baby on their back. Do not place blankets, pillows, stuffed animals, or bumper pads inside the crib. There are no approved products to aid with safe sleep, such as positioners or wedges. Have your baby sleep in their crib in your room for the first 6 months. Sharing the same sleep surface increases baby's risk of SIDS and suffocation. This risk is even higher in babies less than 4 months old. Safe sleep measures begin in hospital. Babies are placed on their backs in their baby bed to sleep. It is against hospital policy for sleeping mothers to have their baby in bed with them. Babies who are usually placed on their back to sleep, but are then placed on their tummies to sleep, are at much higher risk of SIDS. For this reason, it is important that you, your partner, family, friends, and caregivers know to always place baby on his or her back. Once baby's cord has healed and falls off, he or she does not need a bath every day. You can find a schedule that works for your family. Pick a time when baby is quiet and awake. However, every day you should wash your baby's face with warm, clean water. Wash their hands and diaper area with a clean washcloth and mild soap, and rinse well. For a bath, choose a warm room with no draft. Spread a large towel to lay the baby on. Remove your rings and watch. Wash your hands, then fill a tub with lukewarm water, not hot. Test the water with your wrist or elbow. With baby in tub, wash baby from top to bottom, from clean to dirty. Use only clear water when washing baby's face and a mild soap on the body. Rinse well, especially in the creases of the neck, groin, and legs. Wrap baby in a warm towel and dry carefully. Avoid using baby powders. For bath safety, never leave baby alone in a tub or on a table. Don't turn your back, not even for a minute. Collect everything you need before you begin. Fill the tub and test the water temperature before putting baby in. Never add water once baby is already in the tub. And keep one hand on your baby at all times. When lifting baby into or out of the tub, hold the hips and the head. Use both hands and hold the baby close to your body. Your baby's umbilical cord will dry up and fall off in the first 7 to 10 days. Until then, Place baby in a tub of clean, warm water once a day and pat dry around the cord. When diapering, turn the top of the diaper down to let the air help dry the area. See your healthcare provider if it becomes red or inflamed, smells bad, or has any discharge. Jaundice is a yellow color noted on baby's skin and sometimes in their eyes. The baby's body will break down extra red blood cells into bilirubin and get rid of them through elimination, wet and dirty diapers. Sometimes this bilirubin builds up in the body. Your baby will be assessed for signs of jaundice while in hospital. The feeding and elimination record that you keep will help with this assessment. Babies who have higher levels may be lethargic and slow to feed. Feeding your baby frequently in the first few hours and days after birth will help reduce the risk of jaundice. Jaundice gradually disappears in most cases. Preventing positional plagiocephaly, or flathead. Babies tend to turn their head to one side when lying on their back. Because their skull is very soft, they can develop a flat spot on their head. This can be prevented by alternating the position of the baby in the crib each day. One day, place your baby with their head toward the head of the crib. The next day, place your baby with their head toward the foot of the crib. Start giving babies supervised tummy time in their first week of life. This means set your baby down on their tummy while they are awake to play for a few minutes at a time, increasing the time each week. This can be done 3 times a day. Not only does this help prevent a flat spot on the head, but it is also good for baby's overall physical development. Infants who need special care or who need a period of observation are admitted to the neonatal unit. Parents are an important part of the baby's care team. When choosing a car seat, make sure it is Canadian and check the expiry date. Read the manual so as to be familiar with your car seat and have it installed in your vehicle before the due date. This is a great checklist to get you started. At discharge, your nurse will check your identification bands and the baby's to ensure they match. Please leave them on until you are out of the hospital. The nurse will ensure that all your teaching is done, will answer any further questions you may have, and will discuss follow-up care for baby. Crying. Remember, always check with a doctor if you think your baby cries more than they should or if the cry is different. Crying is baby's way of communicating and letting you know they may need something. It usually increases at 2 weeks of age and peaks at around 2 months of age. It is normal for a baby to cry between 1 to 4 hours a day. It happens most often in the evenings, and it may not stop no matter what you try. Crying may come and go, and you don't know why. Try different ways to soothe baby when they're crying, including feeding, burping, changing the diaper, cuddling, rocking, or carrying baby, a warm bath, a walk in the fresh air, a drive in the car. Try decreasing stimulation. Create a soothing background noise or lower the lights. Distract your baby. Remember, these tips won't work every time. Find other ideas and ask for help. Even the most loving and kind caregiver can be frustrated by a crying baby. Put baby in a safe place. Walk away. Take a break from the crying sound. Call a good friend and ask for help. Take a warm bath or shower. Remember, if your healthy baby cries a lot, it does not mean there's anything wrong with baby or with you. If a baby is shaken in a moment of anger, it can cause a lifetime of effects. Shaking a baby can damage a child's brain, cause permanent disabilities like blindness or paralysis, and even cause death. Never shake a baby. Have a clear difference between daytime and nighttime sleeping. Have enough nap time during the day. An overtired baby will not sleep better at night. Make sure your baby is warm, but not hot. Have a routine that you follow at night. Put your baby to sleep in a safe sleeping environment. The Canadian Pediatric Society released recommendations in 2004 that discourage bed sharing for the first year of life. How do you know when your baby is sick? Contact your healthcare provider if your baby has the following: fever, a temperature over 38 degrees in a baby less than 3 months old needs to be seen by a healthcare provider. Limp, lethargic, or does not respond to you, or is irritable. Baby won't eat for 2 or more feedings in a row. Yellow skin or eyes. Umbilical cord smells increasingly bad, has discharge, or skin around the cord is red, swollen, or warm. If baby has frequent diarrhea or vomiting. If baby does not urinate as often, or urine is dark yellow and concentrated. If you require support at home, have any issues or concerns about your newborn, contact your healthcare provider. If you don't have a healthcare provider or are unable to contact them, you could call telehealth, make an appointment at an after-hours clinic, or go to your local emergency unit. Thank you for watching Horizon Health Network's video on baby care. We hope this video has provided information and tools you find useful. We hope this video has provided information and tools that you find helpful. Thank you for watching.